Hello, everybody. We are in UnitedHealthcare, and this is our competitive analysis. So first, we're going to be talking about the competitive intensity. We, as UnitedHealthcare, are positioned as a key player in the managed healthcare insurance industry, causing the company to compete at the highest level with four major factors affecting the competitive landscape.
Next, we'll go into the determinants of competitive intensity. We'll start with market demand, which consists of the demand for weight reduction treatments being extremely high, and it is going to stay in this trend, especially with increasing obesity prevalence. Next, there's coverage offered. With the immense cost of weight loss drugs and surgeries, coverage of these treatments remains in question. There's also cost management, which competitive intensity will center around, as long as they keep balancing their price premiums and the cost, keeping the delivery of high quality services intact. There will also be regulatory factors which affect the competitive intensity. It will continue to guide and impact the weight loss and health insurance industry.
Looking at the concentration ratio to see what it can tell us about competitive intensity within the industry, we see that it's 40%, so below the benchmark of 50%. But we still see the largest insurers having high market power and the ability to dictate trends within the health insurance and weight loss industry, and specifically that being kind of competitive cooperation among the top insurers to decide to not cover a lot of these weight loss drugs currently. Looking at industry influences, starting out with the industry environment, we can see there's a certainty for very high demand for these weight loss drugs due to the high prevalence of obesity and the expected increase in coverage from employers and insurers. On the supply side, we can see there's an uncertainty in coverage. Not from the drug manufacturers, there is a certain supply, but for the matter of coverage, we can say it is a bit more uncertain. Currently, private insurers, it is at their discretion on whether they're going to cover these GLP-1s or not. For Medicare, they exclude GLP-1s as an obesity treatment, and for Medicaid, very few states currently cover GLP-1s. So we can see that the coverage of these weight loss drugs is a bit more uncertain. Moving on to regulation, in the industry environment, insurers are limited by the 80-20 rule. So this is a rule where 80% or more of money from premiums must go towards medical claims and activities that improve quality of care, while 20% can go to administrative overhead, marketing costs, and then whatever's left over goes to your profit. This is important to note, especially for our large groups. The rule is actually 85-15, which means that their profit is just very limited, and that'll impact competition within the industry. For specifically on the weight loss drugs, the FDA and CMS regulations have a large impact on the industry as well. The FDA provides approval on the weight loss drugs, and then the CMS decides whether Medicare and Medicaid will cover the drugs based on the FDA's decision. Looking at the structure of the industry, there's a select group of large insurers, that being the top 6, which all have a market share of over 5%, that have a lot of market power and kind of dictate the industry. They primarily serve the same type of customers, that being large groups, employee groups, Medicare and Medicaid, and also serving a smaller segment of direct-to-consumer. That we can see this trend across other weight loss players as well, being that the size distribution is similar in the drug manufacturers, alternative weight loss companies, where there's a couple key players that are dictating competition within the industry.
Apologies. So moving on to the industry history and institutions, this healthcare industry is generally very mature. However, because of the evolving nature and volatile nature of the rising weight loss industry when it comes to specific patterns, a lot of market leaders have higher power due to market consolidation. And that adds to the market dynamics to be ever changing. Some facilitating devices here, the main one is regulation. We can see that especially for the weight loss industry, because of rise in the new drugs, the regulatory tension is rising, and that comes from the managed care, which the top insurers have expanded and becoming medical service providers, as well as the coverage, which regulation dictates coverage rules for large government programs like Medicare and Medicaid, a big player within the industry.
We've identified two strategic dimensions to base all of these groups on, one of them being cost and the other being quality. And quality, we're looking at effectiveness in the treatment as well as coverage. So our company is UnitedHealthcare, which is in the group along with Kaiser Permanente, Cigna, et cetera. And these are considered payviders. So these groups serve as both health insurance companies, but also healthcare service companies. Other groups include simple healthcare service providers, weight loss program providers, medical surgery equipment providers, and then lastly, weight loss drug providers. Now, moving on to the competitive spectrum, we've identified this industry as being closer to volatile than stable. However, we've identified that there's extremely low volatility just because there are some strategic groups and they are competing for customers who are looking to lose weight. But there are areas for new entrants, which drug companies have kind of taken over. As for the characteristics of strategic groups, we've identified mobility barriers as being extremely high because of the increased regulation and the concentrated market share within the top 4 companies. As for the bargaining power, we've also viewed this as high just because the insurance companies, specifically UnitedHealthcare, helps to cover costs of the other groups. And then lastly, for threat of substitutes, we've identified this as being low just because the demand for insurance will remain steady as it is a necessity. And exposure to rivalry, we've identified this as moderate just because health insurance companies, their work is intertwined with other groups. And so they're exposed to the rivalry between different groups, but not within different groups. As for the firm's position within its strategic group, the degree of competitiveness, we've identified this as being moderate just because there are a few large insurance companies. Scale of the firm, the UnitedHealthcare group is one of the larger firms within the insurance industry. Costs of entry are extremely high just because it's a very capital intensive and costs a lot to establish a network. And the ability to implement strategy, UnitedHealthcare is extremely able just because they are a market leader and one of the leaders of pay providers.
Moving on to Porter's 4 corners analysis, here within the driver, here we're partnering with Mayo Clinic as a potential win-win partnership. And for Mayo Clinic's future decisions, it's based on the drivers, which include their financial driver of revenue from consultation, surgery, diagnostic procedures, and other treatments, and their value mission, which is maintain and enhance its reputation for providing exceptional patient-centered care. Within the weight loss industry, their current strategy involve around medical evaluation and management, the nutrition and diet counseling, which is a big part of their major offering, physical activity and exercise program, behavioral and lifestyle modifications, and surgical interventions when necessary. We can see that they have a full suite of service in their current strategy. When it comes to management assumptions, their strength lies in the coverage that they have across various different major fields in medical and primary care provides. And their high R&D budget of $600 million annually. Their weakness is their high operational costs due to medical experts' high salary, as well as relatively lower hospital counts when comparing to other major hospital chains in the United States. And lastly, but not least, capabilities within Mayo Clinic, they have wide network, including 16 hospitals, 53 multi-specialty clinics, and 40 plus members across the globe. while their Mayo Clinic diet, as mentioned before, is the leading weight loss diet featured in 10 out of 11 best diets in the United States. And this win-win partnership will benefit UnitedHealthcare in reducing their coverage through their reducing drug offering, and authorize specific Mayo Clinic doctors to be able to prescribe GLP-1 drugs. For Mayo Clinic, they have increased number of users for their diet offering because of this partnership and UnitedHealthcare's large coverage group and the increased number of patients due to the partnership.
Just to wrap this up, we wanted to also talk about the strategic use of the Mayo Clinic diet, which the U.S. News and World Report voted the best diets in 2023. So if we implement this practice, we can ultimately have less GLP-1 drugs prescribed, which then will be less of a coverage cost for us. We highlighted this in the chart to the right, the utilization of the existing leading diet plan, and then how we can coverage cost cutting for UnitedHealthcare by using this plan.
Thank you.